PPE on. The scene is safe. My MOI is a gunshot wound to the right distal humerus. I only have one patient. I'll request fire and police as backup. There's no need for me to consider C-spine at this time, and I'll go ahead and determine this as a load and go. My general impression is I walk up on a 26-year-old female. She's lying on the ground. She's got blood flowing from her arm. She seems to be alert and oriented. Life threats at this time would be she's got blood coming out of her arm. Her airway is open and patent, so there's no need for me to put an adjunct in at this time. Her breathing is adequate. She's got equal chest rise and fall. I'll go ahead and put her on some oxygen at a non-rebreather at 15 liters per minute. Let's see, I'll go ahead and check her pulse. It's at 110. Her skin appears to be warm, pink, and clammy. I'll go ahead and try to stop the bleeding with a pressure dressing. And if that doesn't work, I'll go ahead and apply my tourniquet to help stop the bleeding. Okay, and now I'll go ahead and do my head to toe assessment to make sure there's no more injuries that I need to treat right now. I'll check the face for any deformities that could affect the airway. I'll go ahead and check the neck for tracheal tugging from JVD, and then I'll check the back at C-spine to make sure there's no step-offs. I'll check the chest. I'll inspect and palpate and auscultate. Everything seems good. The abdomen, I'll inspect and palpate and auscultate as well. Everything seems good there. The upper extremities, I'll check for PMS. You can go ahead and squeeze my fingers. And I'll do the same with her legs. Can you wiggle your toes for me? Okay. I'll check the pelvis to make sure there's no movement there. There's no bleeding or anything that needs to be treated immediately. Okay, I'll go ahead get some vital signs. The blood pressure is 144/86. The pulse is still sitting at 110, and respirations are at 24 right now. I didn't see any secondary injuries that I need to treat right now, so I'll just go ahead and reassess every 5 minutes, vitals, AVPU, and PMS, en route to the hospital.